I'm Dr. Eric, urologic surgeon and men's health expert. Let's talk about testicular lumps and what they might mean. I'll discuss several types of common masses of the testicles. Even though testicular cancer is very rare, affecting only 0.4% of men in their lifetime, I see tons of patients who come into the office with a mass, worried that they have cancer. Usually they have lots of anxiety about what the issue is, which is totally understandable. My hope is that this video will help to relieve some of the anxiety if you've noticed a mass on your testicle. Now, the first thing I really have to say is you need to go get checked out by a healthcare professional. I can give advice and information, but ultimately you need someone to examine your testicles who knows what they're doing. The way to properly examine the testicle is with two hands. One hand should hold the testicle in place while you move the thumb over the top of the testicle, feeling for any lumps or bumps between your thumb and forefingers. What should the normal testicle feel like? I describe it to guys as the consistency of a hard-boiled egg without the shell. It should be firm, but not hard. You should not feel anything that feels like a rock or a stone or a pebble in the testicle. There is a second structure attached to the back of the testicle called the epididymis. This runs up and down the back of the testicle and feels like a thick, soft noodle. Toward the top of the testicle, you can then feel the spermatic cord running up the scrotum and into the groin in an area called the inguinal canal. The cord should also feel like a thick, soft noodle. Now let's talk about testicular masses. When it feels like there's a large sac of fluid around the testicle, that's usually a hydrocele. Sometimes this is quite firm and taut, but other times it can be soft and squishy. If you go into a dark room and put a bright light, like a flashlight, up to the skin over the mass, it should light up bright and orange, like this. A hydrocele is not cancer, though rarely cancer can cause what's called a reactive hydrocele. That's very uncommon, but can happen. If you feel a mass that's not on the testicle itself, but more behind the testicle, that's usually an epididymal cyst, also called a spermatocele. They'll often look like this. These are benign cysts. They can get bigger over time, but unless they are painful or very large, we usually leave them alone. A varicocele looks like a dilation of the veins inside the scrotum because, well, that's what it is. It looks like this. This is very common on the left-hand side. If you have one on the right-hand side, you should see a urologist because it can be a sign of a mass near the kidney. Usually varicoceles are left alone unless they're causing pain, decreased size of the affected testicle, or infertility or problems getting pregnant. If you feel something within the skin of the scrotum, this is almost certainly not testicular cancer. The most common cause is a cyst. It might look something like this. These can be left alone, or if they're bothersome, can be removed. Occasionally, a mass is felt up along the spermatic cord. Most commonly, this is a non-cancerous type of fatty tumor called a lipoma, but can be a rare type of cancer called a rhabdomyosarcoma. We often remove these masses because we just can't be sure whether they're cancer or not without removing them. Most of the time, however, they end up not being cancer. If you feel a mass on the testicle itself that feels hard or nodular, like a marble or a rock or a walnut, this 100% has to get checked out. Your doctor will order an ultrasound, which is a very accurate test at diagnosing testicular masses. The good news is that if testicular cancer is found, they are curable in almost all cases. Of course, you should always get checked out by your doctor, But hopefully this video has given you some answers about what you're feeling on your testicle. Please click the subscribe button to stay up to date on my health videos and leave any questions in the comments section below.